So far in this series, we've discussed what dementia is, how to normalize screening, and how to diagnose dementia. We've also reviewed ways to adapt your assessments if your patients have barriers. Now let's talk about starting a care plan. My name is Vanessa Thompson, and I'm a general internist and primary care physician. One approach to developing a care plan, which you'll see on the Dementia Care California website, focuses on 3 areas. Care partners, which includes identifying, connecting with, and supporting the people who support your patient. Symptom monitoring, which focuses on how to assess and monitor the core symptoms of dementia. And action plans, which is about creating a comprehensive plan of care from brain health to safety planning. Let's talk first about care partners or caregivers. When it comes to care partners, there are 3 important points to keep in mind. 1, you'll want to identify and document caregivers and legal agents, such as durable power of attorney for healthcare and finances. 2, make sure to acknowledge and include them in the care plan. And 3, make sure they are getting care and support too. It is truly hard work. Next, we move to symptom monitoring. This is how to assess and monitor the core symptoms of dementia, the disease management aspects. You'll want to track the progression of symptoms. As a reminder, dementia is progressive and acquired, which means you'll need to monitor closely for new symptoms as they appear. Ask yourself, how are my patient's needs changing? This is how we determine stage, which influences our understanding of their prognosis and care needs. Assess if symptoms are mild, moderate, or severe. For example, a patient with moderate stage dementia caused by Alzheimer's might have a hard time controlling their bladder, whereas a person in the severe stage of dementia might need around-the-clock assistance with daily personal care. Dementia is a very dynamic condition. People have a lot of symptoms, yet they report they don't feel they are addressed by their healthcare providers. Reassure patients that symptoms, such as behavioral changes and memory loss, are expected. Remind them that you'll be a resource to help address these changes. The third step is to create an action plan that addresses clinical and social aspects of dementia care. There are 5 things to consider in your action plan. These are brain health, medication management, comorbidities, safety, and advanced care planning. Let's start with brain health, which really is a centerpiece of all care plans. Your action plan should include key recommendations for improving brain health, like increasing physical and social activity, for example, with an exercise class, or referring to a specialist to correct hearing and vision. It should also include key recommendations for protecting brain health, like preventing harmful medication side effects, for example, from anticholinergics or sedatives. Now let's talk about medication management for dementia specifically. There are many evolving therapies for people with Alzheimer's disease, and some patients may now be candidates for monoclonal antibody treatments meant to remove amyloid plaque from the brain. It is critical to assess other medications for patients with comorbidities to avoid polypharmacy. Each case is unique, so please see our website resources on medication management in dementia, including when to refer your patients for novel treatments. I do want to mention a little bit more about comorbidities, the third priority in your action plan. It's important to assess and reassess a patient's action plan for comorbidities that may be contributing to symptoms. For example, sleep apnea may be contributing significantly to their symptoms. The other consideration is that you may manage a comorbidity differently in the context of their dementia. For example, your goals for diabetes management may be more around simplicity of medication regimen instead of tighter control of blood sugars. In the fourth component of your action plan, you consider safety. Core areas to evaluate and plan for with patients and care partners include things like driving, wandering, access to firearms, home safety, fall risk, emergency planning, and elder abuse. You don't need to handle all these issues alone. For this domain of your action plan, you'll want to connect patients and their caregivers to social and community-based services. These can help promote maximum function, community independence, and safety. The fifth and final piece of your action plan should be advanced care planning. Everyone needs to establish surrogate decision makers. It isn't just about assets. It's about ensuring the patient has an appointed representative to make future legal, financial, or healthcare decisions if they lose the ability to do so themselves. In summary, when starting a care plan, you'll want to consider 3 components. Care partners, which includes identifying, connecting with, and supporting the people who support your patient. Symptom monitoring, meaning ongoing monitoring of the core symptoms of dementia. And lastly, you'll want to develop a comprehensive action plan, one that focuses on brain health, medication management, comorbidities, safety, and advanced care planning. Remember that primary care is a team sport. There are many community resources to help you care for your patients with dementia. Our following videos will touch on some of these, and others are available on our website.